Hello, everybody. Thank you so much for joining us here in person and online. On behalf of the School of Public Health and specifically the Division of Social and Behavioral Sciences, we want to welcome you and thank you for coming. Our speakers today are from the Tennessee Department of Health and are going to talk about the Tennessee Department of Health's data website. And our speakers are Dr. Sonal Thorat, who is an alum, Kendra Middlebrook, who is an MPH, and Liana Dixon, who is joining us virtually. So I think this is a very important presentation for us because especially for our faculty and our students, so that we understand the resources at the Tennessee Department of Health, the data that they have, and how we can access it. So I'm going to turn it over to our panelists and stay until the end because they have some surprises to give out. Thank you.
Thank you, Dr. Levy. My name is Kendra Middlebrook, and I'm an epidemiologist and a program manager at our environmental epidemiology program at the Tennessee Department of Health. Now let Sonal introduce herself as well.
Hi everyone, my name is Sonal Thorat and I'm one of the epidemiologists working with Environmental Health Tracking Project with Tennessee Department of Health. I have completed my master in epidemiology and environmental health from University of Memphis. And since then, I've been working with Tennessee Department of Health. I worked in waterborne and zoonotic disease COVID-19, and now I'm working with tracking. So it's more than 5 years now. Today, I'm feeling very special and excited because I was a student just like you, sitting in this classroom, learning about biostat, epidemiology. So it feels really special to come here and share how that training has translated into a real world. I would like to thank Dr. Ashish Joshi, Dr. Levy for giving us this opportunity to come here and talk to you all about our data portal. Thank you so much. Liana, you can go.
Good afternoon, everyone. Sonal, that is a very hard one to follow, but I'll keep mine short. Thank you all for having us here today. My name is Liana Dixon, and I'm an epidemiologist at TDH and manager of the TDH Health Data website. And I'm excited to, along with Kendra and Sonal, show you guys how this resource can support your work in public health, whether it's for your capstone projects, research, or just generally understanding health in Tennessee.
All right, so without further ado, let's get started. Maybe. Here we go. So today we're going to go through a background and an overview of our health data website. We will also go over how to use our downloadable reports, tabular data, and data stories, how to submit formal data requests, and some advice for those of you who are joining public health. And also we will follow up with a Q&A session. So a little bit of background about the program that we work in. So the Environmental Epidemiology program sits within the Division of Communicable and Environmental Diseases and Emergency Preparedness, which is coined as TDEP for short, and it serves all 95 counties within the state, protecting us from potential environmental pollution. So half of our funding is received from the Agency of Toxic Substances and Disease Registries Partnership, with a grant that is titled Partnership to Promote Localized Efforts to Reduce Environmental Exposures, which is coined as Apple Tree. And their primary activities involve site investigations, which includes this map here, where they basically go and examine different areas within the state before a new location is built on top of them to make sure there's not a high risk of chemical exposure. They also have a program called Choose Safe Places, where they do water testing in child care centers for lead, and they also provide environmental education and outreach about findings for current site investigations and also fact sheet development for any type of environmental epidemiology issues that are currently happening within our state. So this part of our team has had the opportunity to network with plenty of external agencies within Tennessee, including the Department of Human Services, the Department of Environment and Conservation, the Department of Commerce and Insurance, and also internally within the Child Care Resources and Referral Department. the Division of Family Health and Wellness, and the Division of Population Health Assessment. So this side of our team does constant work to ensure that we are safe from any potential environmental hazards. And in 2024, they managed to save almost over $800,000 for schools for lead testing. And the other half of our funding is what is titled as Environmental Public Health Tracking. And I will let Sonal explain more about that.
So before jumping into our data portal, I would like to talk about environmental health tracking program. So how we are connected with data portal and how we are connected with CDC. So basically data portal is a collaborative effort between tracking program and Office of Informatics and Analytics. We work together to develop this project for data modernization. So how little bit background about tracking program. So basically in 1990 and early 2000, public health professionals realized something is important. Environmental data and health data were not connected internationally. We had air pollution data, we have hospitalization visit data, we had disease dictionary, but those data weren't talking to each other. So Congress noticed that gap and asked CDC to create a national environmental public health tracking. In 2002, CDC launched National Environmental Public Health Tracking, and from there, CDC provide national standard, technological framework, and funding to the state. Right now, there are 33 states who are funded with this program for data modernization. Right now, you will not able to see Tennessee in the map because Tennessee has recently received its funding. So think like CDC sets the rule, provides the support, and state is actually doing the groundwork. So how Tennessee enter into the tracking program and why? So before tracking, Tennessee's environmental data was scattered across multiple systems, and it was very difficult to quickly identify the disease, track the trend like asthma ER visit, heat-related illness, and share the information transparently. So imagine trying to do a group project and everybody has a different piece of paper and none of them is organized or connected. That's what it felt like before we started the centralized data system. So Tennessee began its effort way before getting the funding. We have participated in a fellowship program called Association of State and Territorial Health Officials, ASTO, in 2013 and 14, and again 18 and 19. After seeing our efforts, CDC have funded us in 2022 with a National Environmental Health Tracking Program. And since then, our team has building a state level portal linking environmental data and health data. So for instance, searching into a multiple disconnected system, now we have a single user-friendly tool. So you must be thinking what exactly we do in central office. So as I told, we link environmental data and health data together to answer questions like, are the asthma visit related to air pollution? Do the heat wave increase the hospitalization? Are there certain communities more exposed to the environmental risk? At national level, we program collect, integrate, and share the data on environmental hazard, human exposure, and health outcomes. So think like tracking is a detective system for public health. For example, if asthma ER visits spike in one area, tracking let us explore air quality, heat, and housing condition, not just report the number. So it's about answering why, not just what.
Our environmental epidemiology program is just a small section of our division within CDEP and an even smaller section within the health department. So this map just is a representation of the many different organizations and different programs that exist within the Tennessee Department of Health. So this is just to emphasize why our website is so necessary and so integral to the success of data modernization within the state. And I will turn it over to Liana.
Thank you, Kendra. So until recently, all of those TDH program areas that Kendra just mentioned, they collected and published data in siloed spaces across the department's website. This is just a screen grab from TDH's website. And there hasn't been a centralized full service home for publicly available data. And that fragmentation makes things harder than they really need to be. Internal and external stakeholders have to already know where the data is, or what program area has the data, in order to know where to look behind each of these program area boxes. And if they don't, then they submit data requests for information that technically exists, but it isn't easy to find. And at the same time, there hasn't been a standardized process for posting and maintaining public data from our department. And that leads to inconsistencies in governance, upkeep, and formatting across the department. And so we recognize this, and our office seized an opportunity to kind of modernize how we share public health data. Next slide, please. So the TDH Health Data website now serves as a centralized hub for public-facing health data in Tennessee. It's a one-stop shop designed to make data accessible, interactive, and practical, whether you're a researcher, student, community partner, policymaker, etc. The platform is user-friendly and supports multiple download formats so that users can actually work with the data and it can be useful. And just a side note, this website focuses on Tennessee-specific data, but it complements broader sources like data you'll find on websites like the CDC's website, World Health Organization, local health departments, and things like that. Next slide, please. So this platform does more than just organize data as well. It kind of changes how we at TDH operate and how the public engages with us. So first, it reduces workload. The centralized self-service hub means fewer basic data requests and less back and forth for our staff talking one-on-one with members of the public. Second, it increases visibility. So strong search and filtering tools on our website make it easier for users to explore our data, which expands the data's reach and impact. Third, it increases awareness. So many people don't realize how much TDH data TDH already produces. So the site surfaces that work, and it connects the researchers, policymakers, and community partners to our data across the state. Fourth, it directly supports our mission. So transparent, accessible data strengthens evidence-based decision-making and public trust. And then fifth, it sets a governance standard. So structured metadata, consistent formatting, and accessible practices position our department as a responsible data steward. We love to keep things consistent. And finally, it strengthens funding competitiveness. So we too need funding to run our programs and improve them. So demonstrating transparency and infrastructure for TDH makes us stronger applicants for grants and external support, which makes Tennessee as a whole healthier. So in short, better access to data doesn't just help the users, which that's awesome, but it also makes us as a department more efficient, more strategic, more impactful. Next slide, please. Thank you. And now for the main attraction, the Health Data website. So we officially went live in October of 2023, and the goal of the site is simple. We want to make Tennessee's public health data discoverable, usable, and contextualized, not buried in PDFs behind links and all these other things, not locked behind any internal systems, like actually useful. So at the top, users can browse by health topics, or they can go directly to health stories. The homepage also highlights featured content, so things that are timely, high interest, or especially relevant. And then below that, we organize data by topic areas like infectious diseases, chronic diseases, environmental health, population health, and more. This structure helps users who don't know exactly what they're looking for but they like know the subject area and can kind of find it from there. And then below that, you can't really see it in this screenshot, but we also provide quick access to our knowledge base, the formal data request system, and contact and feedback options. So whether someone wants to explore, analyze, or request something more specific, there is a clear path that you can see from the homepage. Next slide, please. And our portal isn't just one type of data. We support multiple product formats depending on the audience and the use case. So we have reports and infographics. These are typically PDFs that are polished, summarized, and ready for policymakers or the public. Second, we have tabular data. So these are downloadable data sets for analysts who want to work with the data in Excel, R, Python, Tableau. We even have a little built-in feature that you can visualize. I'll show you later. And third are data stories. So data stories, like the screenshot that you see on the right, they provide narrative context around the data. So instead of just showing a chart, we explain what it means, why it matters, how to interpret it. And the layered approach is intentional with data stories. Not everyone wants the raw data. Not everyone wants just a summary in the reports. We provide multiple entry points of the data so that the data can serve multiple audiences. Next slide, please. So this is our catalog view. If you were to click into like the view all data button on the homepage, this is where it will take you. And this is essentially the searchable inventory of all available data products. On the left, you can see you can filter. You can filter by the type. So is it a report that you're looking for? That'll be under files and documents. You can look for data sets, stories, documents, things like that. You can filter by category, accessibility status, and then also tags. The tags you can see is like a drop-down kind of menu, and you can go through and see what the hashtags or what the tags are that we have, and they're essentially like hashtags. So anything that's tagged with that certain term will show up if you click on that tag. And then each tile in the middle shows when the product was last updated, how many views it has, and that gives users quick signals about recency and usage. And then this structure that everything is structured in allows someone to either browse very broadly or to narrow down very quickly. You can also see in the top right-hand corner the search bar. So if you know exactly what you're looking for, you can go in and type your keywords. If anything, if we've got anything on it, it'll pull up, just like you would with Google or anything else. So for an example, an epidemiology student could filter for infectious diseases and data sets and then immediately see what's available for analysis. So a few different discovering. Next slide, please. So say you find what you need and you click into the product. When a user clicks into one of our data products, they land on what we call a primer page that kind of looks like this for a PDF. So for a PDF or report, the primer page will show you a short description, last updated date, and then it's going to have a built-in preview of the document to kind of show what you're getting into and quickly assess the relevance without downloading it first. That reduces friction and improves transparency for the end user. And then below the preview, you are able to download the full resource. The goal here is clarity. So before you download something, you know what it is, who produced it, when it was updated. So this is the primer page for a data set. As you can see, there's no PDF preview. This is where metadata really matters. So at the top, we clearly describe what the data set measures, the population included, the time frame, the unit of measure, last updated, data provider, publishing office, file type, geographic level, things like that, to really help you answer the question, what is this data? Can I trust it? Can I use it before you download it? And then if you scroll a little bit further down the primer page, next slide, please, you can actually see what's inside the data set. So this is the same page, you just scroll a little further down, and here you can see kind of like a snapshot of what the data, the tabular data actually looks like. So you have the total number of rows, columns, what each row represents, the column names and their description or definition, the API field names, if that's something that you're looking at doing. And this level of transparency is really important for analysts so that you can immediately see the structure without even opening the file first, to reduce confusion and support reproducibility. So you know exactly what fields you're getting and how they're formatted. Oh my goodness, my light just went off. I've got like a timed light in here. Anyway, so when, oh, next slide, please. Okay, so when you're ready to work with download options, you can download as a CSV, CSV formatted for Excel, for the API endpoint. If you're bringing it into another system, the API option supports automated pulls and integration into dashboards or other analytic workflows. So whether someone is doing like a quick Excel analysis or building a live dashboard in Tableau, the data is accessible in a format that works for them. Next slide, please. Another option with the data sets, and one of the more powerful features of our website, is that you don't just download the data, you can actually explore it interactively in your browser. Say you don't have Tableau. So from any data set page, you can open the Actions menu and then select Visualize and then Create Visualization. And then this launches a built-in editor where you can turn that raw data into charts without needing any external software. And this is especially helpful for like quick exploration, classroom use, or when you just want to understand the data before downloading it. This feature is only available for our data products that have been published as like structured data sets in the portal. So not for like reports, PDFs, data stories, things like that. But very cool feature. Next slide, please. Once you do click into that, here's just like one deeper level to show you. Across the top, you can choose the chart type. So for example, bar charts, column charts, pie charts, timelines, scatter plots, etc. You can switch between them at any time, so it's very easy to experiment what visualization will work best for what you're looking at. And then on the left side are the configuration tools. So these let you select which columns to use, define your axes, adjust how the data is summarized, control how the chart kind of looks. And then at the main top panel, you can also add filters to focus on like specific years, locations, categories, and that allows you to interact with the data dynamically instead of just kind of creating a static image. As you make the changes, the visualization does update immediately, so you can see patterns emerge in real time. And there is no coding or advanced technical skills required for this. It's very much just point and click. Next page, please. And completely separate from our data sets, this is an example of a data story. So this is where we move beyond just the raw numbers. A data story provides the narrative context, background, interpretation, visualizations, pictures, dashboards if that data has a dashboard for it. For example, this hepatitis A outbreak story walks through the initial case, investigation, the spread, and the public health implications. Our data stories are a really great way to see and interact with up-to-date data and understand context and trends and see the visualizations that we as a department have created. In short, data sets show the numbers and then data stories show the meaning. And if you are looking for dashboards or maps specifically, interactive ones, most of them will be embedded in data stories. So remember that for when you are filtering on the catalog and you're looking for a dashboard, most are listed as data stories because they're just embedded right in the page. Next slide, please. Okay, so now I'm going to hand it over to Sonal to dive a bit deeper into the data that the environmental health tracking team has available on the website and explore one of the dashboards that she manages. I don't know if you guys might be muted, but I can't hear you on my end.
Okay, can you hear me okay?
Yes.
Okay, so we have a different kind of data available on data portal. We have data for air quality, water, heat related illness, chronic diseases. In that we have asthma, heart attack, cancer, COPD, and so on. We have maternal and child health, and we have unintentional poisoning, that is CO poisoning. So this is the dashboard that I have created and published on a data portal. So I'm just going to give a quick demo for that. So I have been extensively working with Tennessee's chronic data and develop multiple public-facing dashboard in Tableau. Today, I will just walk you through one of the dashboard that I have published. It's Tennessee's heart attack hospitalization dashboard, covering from 2012 to 2021. The data source for this dashboard is coming from Tennessee Hospitalized Discharge Data System. We have an agreement with our grant. We have agreement with Tennessee's data system that they share data with us every fall. So this data is coming from there. We can examine the state level and county level pattern over the time. So let's start with the first tab. It's an hospitalization map. So the tab summarizes the annual heart attack hospitalization rate, crude rate, age-adjusted rate per 10,000 Tennesseans. The crude rate reflects the total number of hospitalization divided by total population, while the age-adjusted rate account for differences in age distribution across the county. On this map, you see color-coded base, that is crude rate of hospitalization. The darker shade indicates the higher rate. When you click on any county, you will see annual hospitalization rate, crude rate, and age-adjusted rate. On the top of this map, you have two filters, county and year. So for instance, we just wanted to see what is happening in Shelby County. Just go here. So it will give you the exact number of hospitalization for 2012 to 2021. But if you want to go more granular, you can just select the year you want to see. And one of the other feature is that on the bottom of this Tableau dashboard, you can compare this number, like what is happening in entire Tennessee and what is happening in Shelby County. So you can compare this, compare your number with state, as well as you can collect two counties and you can compare between two counties, like what is happening in another county, like Davidson and Shelby County. So this is another feature of that. So in next tab, so for this Tableau dashboard, I have given 5 different tabs. So if you go on another tab, it's basically displays the hospitalization count across the 3 age categories, 0 to 34, 35 to 64, and 65 above. So you can see clear pattern here that hospitalization increases with the age, that is 65 plus. Moving into another tab, and if you will notice, every tab has this county and year filter. So you can go on a county level and can do your analysis. At the same time, you can compare your rate with state of Tennessee and then your county. So moving into the next tab, it's basically age and gender for crude rate. So if you can see here, the hospitalization rate are much higher for the people aged 65 and older as compared to the 35 and 64. In addition to that, the male have higher hospitalization rate than female in both the age group. That suggested that age and gender are major risk factor for heart attack hospitalization. In another tab, so you see this orange line, it represents the age adjusted rate for state. And if you want to compare the age adjusted rate with any county, click here. And the blue line indicates the county age adjusted rate. So this is a great way to see age adjusted rate are important because it allows us to compare the trains fairly. So that's why we had this separate tab for age adjusted rate. In another tab, we have this table format for the same data set. The initial thought process of having this table here, that anybody can come here and download this data directly from the dashboard. So there is a download button at the top of this dashboard, and you can the concept was anybody can come and download it in Excel or CVS form. But right now this button is disabled for the security reason. But hopefully in the future we are expecting it to be enabled. But no worries, we have all the heart attack data uploaded in data portal. So you just have to search for hospitalization data and you can get it in Excel form. So this is one of the example. You will find a lot of the dashboard on chronic disease data on this portal if you want to do any analysis. And Kendra is going to show you the heat related illness dashboard.
Thank you, Sonal. I'm going to walk y'all through one more dashboard. This is the homepage that Liana started with at the beginning of the presentation. And as she was saying, if you scroll all the way down, these are the boxes she was referring to about submitting any data requests or leaving us any feedback. So right now, some of our most relevant topics are up here in our featured content. And since we're coming off the heels of Winter Storm Fern, I wanted to showcase this cold weather-related illness dashboard. This is in contrast to Sonal's data that she just showed you. Her data is more of historical in nature, so it's in the past. And this data set, this dashboard in comparison is near real-time data. So this updates on a weekly basis. And as we can see right here where this big, huge spike was, that was around the time of Winter Storm Fern. I don't know why I'm having so much trouble saying that. And so you can see all of this dashboard represents the percentage of emergency department visits that occurred during that time. And in addition, we also have another tab that displays the amount of falls. So you can see both during those peaks where the rates were the highest for emergency department visits for cold weather. There's a lot more stuff here if we want to keep browsing around for just a second. I do want to go to this catalog if I can. Maybe right here. So this is the catalog Liana was talking about. So if you keep scrolling down, you'll see all of the available data sets and data stories that we have. And if you tag anything, it'll filter it out so you can get as granular as you would like, and especially within any of these topic areas as well. Like Dr. Levy said, we will have some special goodies at the end, so you'll have plenty of time to explore this resource for yourself. And I'm going to go back to the PowerPoint.
Before submitting a data request, I encourage you to check out the health data website first. Many data sets and reports are already available. So do use the filters and search tools to explore our existing data sets, reports, and data stories. And if you don't find what you need there, please check the main TDH website as some data may have not gotten like migrated yet to our new health data website. Like I said, we went live in October of 2023. So just a couple of years ago, and we have tons and tons of data products, reports, things like that online for our department. So we are always migrating that over. It's quite a big lift. We do have, I think, over 500 things on there right now, but definitely that is not the end. We are putting more on every day. So if you don't find what you need on our website, please check the main TDH website. And then if you still haven't found it, and what you need really isn't there, you can consider submitting a formal request through our system. Like Kendra just showed, it's at the bottom of the homepage. And you can like fill that out, say that you're a student, what you're requesting, why you're requesting, and that will go to our data request team. Please keep in mind that these requests take time to process and they go through multiple approvals and reviews, and it involves data stewards who ensure compliance with privacy and reporting rules. So formally requesting data is best for long-term projects. Think like 3 to 6 months in advance. But if you need data urgently or you're on a tight deadline, reaching out directly to the program area may be a better option. For everyone joining us virtually, this is what I was talking about. Again, just if you're looking for a certain type of data, check our health data website. Because once we migrate it over from the TDH website, usually we're deleting it from the TDH website. So this will be our main truest source of the data available. If you don't find it on there, check our TDH website. May not have been migrated yet. Still don't find it, and this is like a long-term project, very important for you, please consider submitting a formal data request. There's a lot of hoops to jump through on our end, so it takes a while. But if you are able to request like enough time in advance, then it's a good option. And again, if you are on a tight deadline or need it urgently, reaching out directly to the program area at TDH and seeing what's possible for them is a good option as well. Please, next slide. So if you're wondering how you can use the data on our site, you can use the data that TDH puts out for a few different, you can use it a few different ways. So you can analyze health disparities across counties, evaluate public health programs, or identify emerging or long-term trends. If you're doing a capstone for your school program, you can use this as a starting point for real-world Tennessee data. However, it's important to understand that public health data has a reporting lag. So public health data is not real time as much as we would love it to be. And it takes time to collect, validate, clean, and then release responsibly. So instead of fixating on the most recent year, if you've got a topic area in your head and on your mind, then I would suggest to focus on trends over time. That's also a very important thing to look at and take into account for any health condition. And that's really where the insight lives as well. Historical data is incredibly powerful. It lets you see patterns, shifts, impacts in a real way that a single recent data point never can. And if you understand that limitation going in, you'll use the data much more effectively and you'll interpret it correctly. So always check suppression notes and denominator sizes as well. Small numbers can look dramatic, but they aren't always stable. Next slide, please. So if this kind of work that we have talked about today interests you at all, and if I could just give a small piece of advice, here's what I feel like matters in today's workforce. So first, technical data skills, and you really don't need to master everything, but fluency does help. So pick one or two: SQL, R, Python, Tableau, Excel. Those are all commonly used across agencies. And then second is epidemiology and biostatistics. Again, that's speaking for this line of work. Public health is so broad and can encompass a range of different career paths. But for what we do, the foundation that you have in epi and biostats, that matters. Tools can change, but the methods behind them, they stay consistent throughout time. And then third is communication. So if you can't explain your findings clearly in writing and verbally, your impact shrinks. So public health communication to the public is very important for whatever you do. Project management is underrated, but it's critical. So public health work involves timelines, partners, deliverables, grant metrics, things like that. So you want to be able to manage all of those effectively. Don't let anything slip through the cracks. And then policy literacy also matters. So understanding how data influences decisions, that is what really separates the analysts from the leaders. And then growth opportunities. So if you can, attend conferences, join professional organizations, use LinkedIn strategically. You can build connections. You can put your resume on there. People actually look at that. And then you can find a mentor, ask questions, volunteer for projects that interest you, and gain experience wherever you can. So internships, assistantships, contract roles, research collaborations, skills compound. And let's see. I feel like I wanted to mention something else. Oh, just listing a few conferences. APHA, that's the American Public Health Association. The CSTE is the Council for State and Territorial Epidemiologists. NACHO is another one, big for local health departments, specifically, I believe. And, connecting with professionals at conferences or on LinkedIn, just helping to grow your network in general helps. Next slide, please. And then, like I said, public health careers are broad. You've probably noticed this in your classes. So start with national organizations like APHA or publichealthcareers.org for general listings. And then you can look at universities and schools of public health. They often post research and project-based roles. Government agencies like local, state, and federal agencies are major employers, and that does include departments like TDH. Nonprofit and community organizations also hire analysts and program coordinators. And don't overlook the private sector. Healthcare systems, consulting firms, tech companies, they all do hire public health graduates. But the work that we mostly interact with is that more like public government level thing. Also remember that your professors are already in the field and may know of opportunities. So do stay connected with them and keep your options open. And the last thing I'll say, in addition to finding a job, you can also be found. So like I mentioned earlier, keeping your LinkedIn profile updated because recruiters are looking, and a few of my colleagues were hired on that way. So the key is to just apply broadly, stay persistent, and tailor your resume to the skills that you are applying for. Next slide, please. Now is the time that we would love to hear your thoughts and questions. So whether it's about using the website, requesting data, applying to TDH, anything, please do feel free to ask. I think we might have a few minutes. So yeah. Oh, I also was going to paste in the link for the internships. Let me do that as well.
Thank you, Liana. We have a question in the room if no one has one online right now. Are there any questions online? I can't see the chat.
Doesn't look like it yet.
Okay.
Is there any listing PDH of the data sets that you have?
Yes, if you go on that page that I clicked on after the home page, if you filter it to data sets, it'll show you only the data sets, and that'll be like the tabular data that Liana was talking about, so the stuff that you can download and do your own analyses with. So anything you click on when you go to just hit data sets, it's not going to take you to like any type of specific condition or anything. It'll just show you only data.
And so I have a couple of questions. First one is, I noticed the data, they have a county and so on, but you also, I mean, not really county, I think city or something. So do you have like the those kind of more detailed location, like what is it called? The shape file, right? So like tell me people the location of those events that I could.
Yeah. So yeah. So the question is like the dashboard that I published. So there is a county level of data. So I think the question is it like granular data is present? Like, so we have addresses, we can go into a granular data, but whatever data is published on a portal has to go through a lot of scrutinization, go through a governance system. So even though we have data, but we cannot publish it, so we have to go for a separation rule. We have to make it aggregated. We have to make sure it is de-identified. So if we go on that granular level, it breaks the rule of, it can be like, it can be identified. So we don't have that like right to publish those data set, but on the background, we have that data.
Even at the county level, is that right? Even at the county level, people, they cannot get, you know, those type of data, or because I think, you know, for some situations, they want like spatial, that type of GIS-based analysis.
Yeah.
So for those type of data, probably
No.
it's difficult. Okay.
No.
And then my second question is, like, when you have like for people request for data, is that like you have a specific timeline for them to finish, or once they get the data, they can use that data forever? You don't request any report within a certain timeline, or you do?
So the question was, when someone submits a data request, is there a certain timeline that they need to complete anything with that data, or is there a certain report that the Tennessee Department of Health requires once that analysis is completed? And Liana, you can correct me if I'm wrong. I believe they have a year, and then they have to delete that data from their own personal stuff to do the analysis. And I don't believe we require a report or anything about what they produce, but I think it's encouraged. Do you have any additional insight on that, Liana?
No, I think you've covered it.
Okay. Yes.
I'm sorry if you already talked about this, but may I know what is the source of the data?
So the question was in the room, what's the source of the data? And that's going to vary depending on the type of data that's produced. The data that Sonal shows you with the emergency department visits and hospitalizations is going to come from the hospital data, the hospital discharge data system, which is managed by the population health assessment team within the health department. For different things like radon or like heat or even that cold weather related illness dashboard that I showed you, that's going to come from like state labs or the National Center of Environmental Information. And also that cold weather related illness dashboard that I show you all utilizes a data source that's called Essence, which is like emergency department, like if you go to the emergency department and they code it in the computer, it'll automatically program it and show that you were there for a certain condition. But the limitation with that type of data is, since it's preliminary, when they go through and review it at the end of the year, just because they tagged it as like a fall, it doesn't necessarily mean that was the only thing they were there for. So it might get recategorized. So that's the difference between like that near real-time data, historical data, and things like that. So it really just depends on the type of data that you're looking for, where that source will be. But it'll always list the source within that metadata that Leona explained. So if you have any questions, you can always reach out to whoever published that data set or that department that it came from. Yes.
I have a simple question. The data from the TDEC website can be the same or different from EPA or CDC?
The question in the room was the TDEC, you said TDEC? The data that TDEC publishes, is it similar to EPA or CDC's data? I'm not entirely sure of like TDEC's entire like data process and anything, because they're a separate department from us. But I do believe that they have to submit stuff to EPA. And I guess they go through some kind of revision process with them. It's probably just similar to us, where it's just like getting validated and re-verified before they can publish it or anything, I would believe.
Thank you.
Yes.
So do we have the prospect of comparing data sets of tenancy with other states to visit the website?
Yeah, but he said on this website. So the question in the room was, do we have the ability to compare any of the Tennessee data to other states within our health data portal? And that is going to be no, but you can compare it on the National Environmental Public Health Trackings Data Explorer. But that's only going to be for like our environmental health data, some chronic disease data. They have their own indicators, and the Tennessee Department of Health has a bunch of other separate data, since we have a bunch of other departments as well. But if you're interested in like some of those indicators, the National Environmental Public Health Tracking Data Explorer is the best option for that.
Yeah, because some of the data is being collaborated with CDC, right?
At least with our stuff, yes.
So yeah, I was just trying to know if it made a sense, like if we compare data from Tennessee's portal and this complete national portal, would it be the same?
Oh, yes, the data is still going to be the same, because we send that data to CDC and then they validate it and then they post it on the national portal. So it shouldn't be much variation between that portal, the data that's on the national portal, and the data that's on our health data website. I'm sorry, I misunderstood.
All right.
Any other questions in the room? Are there any online, Leona?
There was one asked if one wanted to access the API, how would they get the necessary API key? I responded to that in the chat, but for anyone not on the chat right now, I said at the time, the portal doesn't support the issuance of API keys for public audience, but the data sets are publicly available via API endpoints, which is usually all you need to access and integrate into your own like R or SQL or something like that.
All right, thank you. Well, if there are no more questions online, and I don't believe there are any more in the room, I believe we are finished with this here today. So I'm going to stop sharing my screen. Thank you so much for having us here today.
Thank you all.
Yeah, good to see you. Yeah. All right. So we are going to conclude here. So if you all need to sign off and go enjoy your lunch, then please go do so. Thank you so much for attending.
I just want to say a quick and heartfelt thank you to the Tennessee Department of Health, to Sonal Thorat, Kendra Middlebrook, and online Leona Dixon. They really provided a lot of information that are helpful to us and to our students. So thank you for coming. Appreciate it. And they have some goodies that they're giving us, and enjoy your lunch, and thank you again.
Thank you all.